Hello, everybody. Welcome to the COVID Weekly Roundup. This is Deanne Walters stepping in for Jason Belden, who is off today. You've found yourself at the DPP Weekly Roundup, where we cover most recent AFLs, anything from CMS and the version of QSOs, and we do have a couple of those for you this week. It is May 14th, 2021, and it's about 1 o'clock p.m. Today, as a guest, will be myself, and guest speaker would be Ppe Owens. So she's going to jump in, our Director of Regulatory Affairs with CAP, for mostly your questions, but she's going to add to some of the information, the QSOs, as we go along. So you'll be able to hear from the both of us. So we want to welcome you, and part of our introductions, of course, we want to make sure that you understand that any of our opinions that we express are our own. They are not a reflection of CAP's official position. The Disaster Preparedness Program is a grant-funded program, and therefore, as being a CAP employee, both Ppe and I do not have any financial conflicts. So the intent of these webinars every week is obviously to give you a situation rep. So we're going to talk about things that are going on, review the most recent guidance so that you can hopefully be better aware and implement what is being expected of us. Hopefully we'll talk a little bit maybe about the forecasting and share any best practices as we roll through. Probably mostly those will come through our questions, and we can discuss some of those things that we have. So we did get a couple of updates, not the updates we were looking for this week. So some of the general skilled nursing facility visitation updates since the new QSO came out have not dropped. So we've got another week to go. Sometimes they happen to drop over the weekend, and so if they do, we will make sure to push them out on the CAP forum. But we did get some guidance that we were hoping to get and have been advocating for some time here at CAP, and that's the visitation guidance specific to our ICF, DD, HN, and CM facilities. So we're going to be talking about that as we go. And then we did get some information from CMS, the QSO 2114, which is talk about, doing the indoor, I was jumping ahead. So that's specifically around using those things for the ICF DDN, and we will be talking about the vaccination QSO that came out. I jumped ahead. I saw QSO and I got a little crazy. So this AFL that came out, 2114, is something, like I said, we have been waiting for. And it provides a visitation guidance for our ICF-DD facilities in regards to, of course, the coronavirus pandemic. So it's going to apply to the home as well as the facility and staff. So we need to make sure that we're paying attention. So on here, we want to make sure that our staff must, regardless of their vaccination status, wear a mask for source control, and then maintain that physical distance from any visitors. And these are going to be really important. I know we've seen a lot of questions around that coming up on the forum, and the issues around that are, because they're saying, you don't have to have a mask anymore, right? The information from CDC today says if you're vaccinated, you don't need a mask. Well, we need to step back because we are a healthcare facility. So that is not applicable to our staff when they're on our site. And I would also encourage you, just in your conversations with your staff, to have them be safe and potentially continue to mask when they're out in social environments, maybe not their homes, but when they're out and about, because, though it has been proven that vaccination has reduced people receiving the vaccine, receiving the virus and then spreading it, we would rather not take any chances. So we would say, highly encouraging our staff to continue their vigilance even when they are away from our facilities. So this AFL also asks for everybody to routinely clean and disinfect those frequently touched surfaces in those designated visitation areas after each visit. So take the time to make sure those things are cleaned up. They also request the use of physical barriers during those visits, and so a lot of people already have some of these things in place. And then posting instructional signage throughout the facility on, the COVID signs and symptoms. Again, I think most of our ICFs are already doing this. including the ICC precautions and other applicable facility practices. So we need to make sure it's clear throughout our facilities, all of those guidelines. So the accommodation. So one of the things that they're helping, and hopefully this gives some clarification to our ICF at DD facilities, is the touch-based communication that may be necessary for your clients who have the hearing and vision impairment, so that they can allow touch to occur for our clients. So that communication, of course, as it says, may necessitate higher levels of hand hygiene, respiratory protections, or other protections. So again, we're going to have to make these decisions based on the clients that we have in our facilities, have a care plan that is in place, and instruct our teams on how to handle those very special individuals. So when communicating with individuals who are deaf or hard of hearing, staff and visitors should use a clear mask or a cloth mask with a clear panel. So again, allowing that individual to be able to view the mouth of the care provider, and then hopefully the visitors would also, so that way they can maintain the source control, but make it easier for that communication. And that is a should, if you notice that in the AFL. Visitors who are unwilling to adhere to the recommended principles of COVID infection prevention should not be permitted to visit and should be asked to leave. And again, that puts the onus on the facility to be the police of people's behaviors. So visiting needs to be, in a place where it can be observed and make sure that people are following those requirements. Of course, outdoor visits obviously pose a lower risk of transmission, so those are preferred over any other type of visit. So if you're in a climate that you're able to do so, that is the preferred method of visiting. Facilities should schedule visits. This can be very challenging, but we want to make sure that we are doing that. Places where there are 6 foot or more physical distancing, using those face coverings for residents and visitors, and staff that are monitoring for those guidelines that we were talking about. Outdoor visits between vaccinated clients and fully vaccinated visitors can be conducted without a face mask. I know it feels slightly uncomfortable, but it is where we're moving back to that place of normalcy. And physical distancing, we want to make sure to try and reduce, that closeness, but it is okay to have people that are closer and that actually have a brief hug or hand holding. So you just want to make sure that it is being done briefly as much as possible, and and that we're watching to make sure they're following the guidelines. A little bit more on indoor visits. Visitors must be willing to adhere to the principles of infection prevention. Again, you can ask them to leave if they're not willing to do so, which this is including wearing the well-fitting face mask and maintaining the physical distancing from others from different households. So facility staff and clients, regardless of the visitor's vaccination status. So you don't have to find out what their vaccination status is, and when you're inside, you need to be maintaining those practices. Indoor visits between fully vaccinated clients and the fully vaccinated visitors can occur without the face mask. So if they're willing to share with you their vaccination status, this gives you a little bit more leeway. And that physical distancing as well. So some brief hand holding, brief hugs, those types of things, but 6 feet distancing should be maintained between the visitor and staff. So there's the caveat, right? We want to have a 6 foot distancing between the visitor and staff and the clients when they're not visiting. So again, our staff will be asked to stay distant, but again, the challenge is but still oversee the process. And facilities should limit the number of simultaneous visitors per resident. So a lot of the ICF-DD homes, right, are a little bit smaller, and so you don't have unlimited space. Not that skilled nursing does either. And so we want to make sure that the total number of visitors for each resident and within the facility itself at one time are appropriate for the size and the physical space that you have. So again, having a policy around that will be helpful, and making sure your entire team is aware of that policy, so that way it can be implemented equally across all visitors. So indoor visits, when you do schedule them, they can't be less than 30 minutes each. So just keep that in mind as you're doing your schedule. And again, when you are having them indoors and you have to do that cleaning and disinfecting in between each visit, if you have a specific place, you'll want to include that transition time in your schedule. So you also want to limit visitor movement in the facility, so straight to that space or that room and then out again at the end of the visit. Roommates cannot be present regardless of their vaccination status. So of course they give an exception. If there is an individual that is bedbound and that visit can't be any other location, you're able to do that visit still in that room. Again, you would probably want to look towards the barriers between the visitor and that client and the other client who is bedbound, so that you keep them safe. And so keeping that in mind. They would like you to try and dedicate a bathroom for visitors if possible. It might be something that would be good to put into your plans for visiting, so whatever those policies are, if you have one or if you don't have one, and obviously make sure to designate it so it's very clear if you have the space to have a dedicated visitor bathroom, so that you don't have staff or others utilizing it if it's designated for visitors. And of course, considering ventilation system upgrades or improvements and other steps to increase the clean air into the facility and diluting those potential contaminants. And so there's a link that Jason's provided for that CDC guidance. I of course like to ventilate my home with the windows open, but it gets really hot. So upgrading those ventilation systems, if you're able to do so, would be very beneficial and help provide additional levels of safety for your clients. And then we move on to communal activities and dining. So fully vaccinated clients who are not in isolation or quarantine may eat in the same room without physical distancing. So of course, again, this is vaccinated. But if any unvaccinated clients are dining in that common area, everyone should use source control when not actively eating, and unvaccinated residents should remain at least 6 feet from others. So you don't have to do that physical distancing for vaccinated, but if you have an unvaccinated resident, then masking when not specifically eating should be occurring, and that individual that's unvaccinated should be kept 6 feet from the others for their own safety. Fully vaccinated clients who are not in isolation or quarantine may participate in those group social activities together without face masks or physical distancing. Again, these are fully vaccinated clients, but if anyone that is unvaccinated is present in that group, then the participants need to be wearing face masks for source control, and any unvaccinated individual should be physically distanced again from the others. And again, this does not apply to staff. Staff should remain with source control, whether vaccinated or unvaccinated. So clients on transmission-based precautions. So those who are on transmission-based precautions for COVID-19 should only receive visits that are virtual, like through the windows, or if necessary, that in-person compassionate care situation, which hopefully you all already have policies to provide you some guidelines on how to do that and when you're going to do that, obviously with adherence to transmission-based precautions. You're also encouraged to provide alternatives, right? So creating like a listserv to notify families, assigning staff as a contact, or having a recording on the phone so that your families can access information about the status at your facility. So those are suggestions to have. And of course, at CAF, we want to ensure that people are over communicating with our families in this time that they've been separated. They've been very anxious, and so the better we communicate, whether that's the ICF-BD or in skilled nursing facilities, the better. We want to make sure that they're feeling very much a part of this whole process. So now we get to the big one, right? With clients who leave the facility. So clients and their family need to be educated. It said should be educated about potential risk for public settings, particularly if they have not been fully vaccinated. So one of the things that we always say, right, if it's not documented, it doesn't exist. It would probably be beneficial to make sure that you're documenting that this education has been provided to the client and the family about the potential risks of being in the public settings when they're going on leave. We want to, encourage and assist with adherence to all recommended infection prevention and control measures. So number one, making sure that they know what those are, and making sure that they have source control and other things available to them when they're out. So we want to make sure that they are prepared so that our client can be the safest as they can be. If they're going to be visiting friends and family inside their private homes, they, of course, should be following that source control and physical distancing recommended for visiting with others. And again, a link is provided in the handouts here so that you can take a look at what that looks like. And we want to just overly be cautious as as people are going back out to the community. And if there are any clients who have this prolonged contact, so again, what they define as prolonged contact is that within 6 feet of someone for at least 15 minutes, and that's cumulative. It might be 5 minutes now and 10 minutes another time, or more over a 24-hour period. Someone that is SARS-CoV positive while outside the facility needs to quarantine upon returning, and that includes that immediate testing, and then again, 5 to 7 days after exposure. It doesn't matter what their vaccination status is. All right, so that kind of wraps up that visiting thing. And I didn't mention at the beginning, but of course we will be taking questions. You just have to drop them in the question box, and that is found in the control panel. It should be on the right side of your screen. And when we get to the end of the QSO, then we will jump in and we will be looking at those questions and doing our best to answer them. And if we don't have time to finish all the questions, then we gather them together and we will get them answered in another way for you. So please make sure that you drop any questions that you have into that chat box. Patty, before I go on, did you have anything else specific to that AFL on visiting for the ICFDD that you would like to share?
Yeah, I just want to say, it was much anticipated, long awaited, long needed, and if any of the ICFDDs have any questions or clarifications, CAF is always here to help answer them and help you navigate through the interpretation of these regulations. And so we're really kind of excited about this AFL. However, I'm sure there's going to be some clarification questions. And as those pop up, feel free to email any of the CAF team, and we'll make sure we get you the correct answer or clarification interpretation from CDPH for you.
Terrific, Patty. Thank you so much. It is. I mean, I think that we have been advocating for some type of specific guidance for quite a while. So it's wonderful that we finally have it and have now armed the ICFDDs with that information so they can take care of their clients in a positive manner. All right. So we do have this AFL 21-15, and this is not the push packs that came out before. This is specific to PPE, and they're asking for you to request a 30-day sustainment supply of the state's PPE inventory. So all of you, all the facilities, should be requesting these resources from your MOOC. And facilities need to utilize that Salesforce sign up. And I know that Jason has talked about that before, how you access it, and even has a YouTube Salesforce webinar in case you missed it before. So this is a one-time initiative that is going to be pushed out in June. So one of the things that's really important to know is that you are going to need to be building your PPE stockpile. It is required to have a 45-day PPE requirement, and that goes into effect in 2022. And crazy enough, that is not that far away. We're talking about 7 more months, and we will need to make sure that we're having the stockpile for access for our facilities. And so getting this extra 30-day sustainment supply will help you meet that requirement. So the surgical masks come in it, the N95s, face shields, goggles, sanitizer, gowns, gloves, wipes. And of course, Jason being our life and safety code guru, he wanted to make sure to inform you that having too much sanitizer within one of your fire compartments is a violation. So make sure that if you are taking and storing sanitizer, that you are aware of the amounts and the limits on that, and separate them into appropriate fire compartments as appropriate so that you don't have a violation of your life safety. We wouldn't want that to occur as you're trying to prepare for that 45-day supply of PPE. All right, and now we are going to move on to the CMS Qso 21-19. So this is a vaccine immunization requirements for residents and staff. So this is about reporting mainly, but these new requirements, we'll start with this, is for educating residents or the resident representatives and our staff regarding the benefits and potential side effects associated with getting the COVID-19 vaccine. And we must offer the vaccine. So long-term care facilities must report these COVID-19 vaccines and also therapeutic treatment information into the NHSN system. CAF is set to speak to CDPH on Monday about this reporting, so stay tuned. We are advocating, of course, with this additional reporting requirement to the NHSN, and some of the reductions that we are seeing in other areas of concern around the pandemic, that the reporting to CDPH be reduced or eliminated, and then we transition just to this NHSN reporting. So hopefully that conversation goes well on Monday, and of course, as soon as we have information, we will push that out to all of you. So AHCA has tools developed to assist with vaccination toolkits, and the American Healthcare Association, you can access their website to do that. In regards to the educating residents, representatives, and staff, we must provide all the relevant CDC information on that vaccination, and that includes that EUA statement. And we need to be aware of those statements if they're updated, because if there's a change, like what happened with the J&J vaccine, we would need to ensure that we no longer handed out the original EUA statements and that we updated it to the most current EUA statement. So you must offer the vaccine to all when it is available and at every opportunity. So working with your long-term care pharmacy partners to ensure availability and that you're able to offer those vaccines is really important. If you haven't already done so, really developing that relationship. At this time, if you're struggling with receiving those vaccinations through your pharmacy partner, it would be advised to work with additional partners in order to make sure that you have it available. You want to use tools and education to drive the confidence in the vaccination. I know that we've had wonderful response from our staff in getting vaccinated. There are, of course, some areas that we can still have additional improvement in. But overall, California has done a wonderful job, and so we just need to go ahead and make sure that we continue to do that and drive that confidence in the vaccine, since we have seen such amazing things for our residents and reduction in outbreaks as well as death in our facilities. And so it is a wonderful thing that we want to make sure we're continuing to talk to people about. So the residents. Yes, Patty.
I was just gonna jump in real quick, Deanne. Sorry about that. I just wanted to add that this QSO was in response to an interim final rule filing So it has went into effect on the date of the filing, which I believe was the 12th. So that's effective immediately. There's a comment period, so there will be comments being submitted on this interim final rule. And I wanted to add that in the beginning so that I could get that clarified for everyone. As Deanne said, we're meeting with CDPH, and we'll see what guidance CDPH is going to put out additionally on some of this, if they're going to do an AFL or not. And I just wanted to add that at the beginning. Thank you, Deanne.
Sure, no problem. It's kind of hard when we can't see each other to know when someone wants to say something. We need hand raising ourselves. But yeah, so this is part of that interim final rule. From the date that the QSO that final rule came out, there's 10 days until it becomes effective. And so I think that puts us into May the 21st, in which it's effective. And there is initiation where you have to have your very first report, and that is in June. And so I think that's in some of our later slides, so we should be able to get there for you. So again, we must educate residents, resident representatives, and staff. And of course, again, like I mentioned before in the other AFL, we need to document that it's being done. That people have received the education on that. Hopefully you already have that in place, but if not, you want to make sure that you have a way that people can acknowledge that they have received that education, and also acknowledge whether they are agreeing to receiving the vaccine or if they are declining the vaccine. So we want to have all that documentation in our hands so that we're able to move that forward.
Additionally, I'm sorry, I have a lot on this, Deanne. I'll be jumping in here and there. I hope you're okay with that. And additionally, I wanted to point out that this came out for all long-term care facilities and including ICF, as Deanne said in the beginning. However, there's a distinction that the reporting is not required, only the educational portion for the ICF portion. And I wanted to clarify that also. And I just want to make sure as we talk about this, what portions apply to long-term care facilities, which under CMS, which this came out federally, long-term care facilities, that's what they refer to as skilled nursing facilities, and they included the IMDs, ICF for that portion. So I wanted to clarify that.
Terrific. Thanks, Patty. I appreciate that. Yes, that is a big distinction. Because our ICFDs do not have to put this information into NHSN, though they are highly encouraged to do so. One of the reasons that, if you already have access to that NHSN to do it would be to show, what a great job that you've been doing. I know, unfortunately, a lot of adversaries say things like, we aren't, our people are not vaccinating, we're not protecting our residents through vaccination of our staff. And I know that is less than true. And so, one way to do that is to go ahead and put that information into the NHSN and show them that, yes, you are, a fully vaccinated facility, and that, our residents do mean everything to us. So thanks, Patty. All right. So of course, I was already just talking about the medical records, and you include that documentation. So this is about our residents, right? Medical records have the documentation that, of course, again, provided education, each of the dose that was given, or if it was medically contraindicated, or if it was refused. So we want to make sure that that is in our residents' record. The facility maintains documentation related to staff, that we've provided education, that we've offered the vaccination right, and then we'll be reporting that status to the NHSN system. And of course, these records go into the employee's personnel file, and in the medical portion of it, it's separate, of course, from the rest of those records. So that way we have proof of it. We will be surveyed to it, and we'll talk to that in a little bit. The requirement is spelled out for those doing their own vaccinations versus a pharmacy partner. So you'll want to look at that QSO memo a little bit closely in those areas. Because I know we do have, of course, our county that is doing all their own vaccinations, and most of the rest of California is working with pharmacy partners. So we want to be looking at that. An AFL is likely to follow from CDPH with these requirements, so we want you to stay tuned. And the other thing that I want to mention, since we're talking about, to remind myself, you know, doing your own vaccinations versus a pharmacy partner. If and when, probably more likely when we need to do boosters, we're going to want to be able to check the vaccination status of not just our residents, but our staff to find out, right, because there's going to be probably a time frame, just like many other things that we do, like the Hep vaccine, where it needs to be like 6 months after the last vaccination, or maybe it'll be a year after vaccination, not sure about the booster yet. But we need to be able to go into that system, and for us, it's the CARES system. And there was a note in our newsletter that just went out yesterday. Jason wrote it up about the 3 different systems. So CARES covers most of California, but we also have a special vaccine registry in San Diego, and another that covers several counties in California. So you need to know which county you're a part of and have access to those systems in order to determine whether or not your staff or residents have been vaccinated. And it is the best way to do that versus asking people to present cards with their vaccination on it. So that vaccination reporting system is going to be your number one way of determining someone's vaccination status, and then obviously making decisions about their care or their employment from there. So we are kind of ran through those AFLs and the QSO really quickly, and so we have time now for questions, and all questions must be entered into the questions box here on our GoToWebinar, and it's on that right side of your screen. I will do my best to read them aloud, and then we will answer them. We've got several here. I'm just trying to see how to see them on a bigger screen.
Deanne, did we cover the regulatory side of this QSO and the final rule, or do you want me to say a little bit about that?
Go ahead while I try and figure out the question things.
Okay. So we should expect some survey activity based on this final rule and this QSO to start effective when on the 21st forward. Within the final rule, within the QSO, there was definitely some specific regulation changes. There were updates to the guidance surrounding immunization and updates to the guidance regarding reporting. I did want to specify that for that guidance, there's some language changes in staff, who's considered staff under the immunization portion, and then education portion under that. There are for the facilities that have conferred their rights over to CDPH to report on their behalf. This is an official, this is definitely a CAS position, is start reporting regardless. Go into NHN, report for yourself, and making sure you're completing all the required modules within NHSN and the fields, if there's no empty fields, while we're awaiting CDPH to update their questions to align, and while you're waiting to make sure there's no glitches either on CDPH's end or the NHSN on receiving the data, which could result in you receiving imposition letters from CMS if you're counting on that reporting to happen from CDPH. You're going to always want to check in on your NHSN regardless if you conferred your rights or not, because even if you conferred their rights, we're hearing about and seeing a lot of issues sometimes on CDPH's end or on the NHSN side of the data pull, and it's causing imposition letters to be issued, fines, and deficiencies. So always check your data. Even if you've conferred your rights, it's your responsibility to make sure the reporting requirements are complete on the NHSN. All providers, whether you're conferred or not conferred, start to put your data in now versus later. There are, so you can make sure if you have any questions or clarifications you needed on what you're putting in there. Additionally, CDPH created a training regarding the new modules for the NHSN. There is a training available. We put that out in our CAF newsletter. We put it out on the CAF forum. But again, if you need that, just email us directly. We can give you the link to sign up for that training. And it's kind of a little bit of a robotic training, but it's also it helps you know what to enter into those fields and what look back period and also what to capture to put in there. So I wanted to add all that in there. And for the regulatory side, hopefully we'll be seeing something also out from CDPH, but I can guarantee surveyors will probably start immediately if you're expecting a survey to start. So make sure you have an action plan on how you're going to get this stuff done, that this is what you're going to be doing, and you're going to have this much done by this time and that much done by this time. So that surveyors ask you questions on any of that process, if you notice something you might need to shore up a little bit, you have what your action is going to be to get that done. And that's it. I'll turn it back over to Deanne.
Thanks, Patty. That actually brought up a bunch of things in my mind from that CMS training, that you also want to start working on a process for the people that come into your facility once a week, maybe a couple times a week, such as like your hospice. You'll also be responsible for including in your reporting those people, whether it be a volunteer, whether it be the hospice staff, or other contracted staff that come into your facility at least once a week. You will be responsible for knowing whether they're vaccinated or not, which vaccine they've received, and then including that in your reporting. So the nice thing about the fact that we have a little bit of time before this is mandatory, and that the first must report date is June 13th. So you have some time to put some of those processes in place, because it might not be, super easy. I don't expect it will be if you're working with, say, multiple hospice organizations and you have, a few different volunteers in your facility. It may be a bit of a challenge to get that information. They probably have staff turnover and such, and so every week it will be, again, a communication thing with those parties that are in your facility, even if they're not on your payroll. So please pay attention to that. And the look-back period that Patty mentioned is a Monday through Sunday period, and it's now, so it's whatever week, that first week you're starting, and you will be required to report, at least start reporting, open up that module in NHSN by Sunday of every week. So even if you have to do some adjusting later, you have to at least have initiated that information input on Sunday of each week. So those are some little caveats that you need to be aware of, and that you can start thinking about now how you're going to be getting that information, and who's going to be the person responsible for it, and how you're going to track week over week, because like I said, it does require you to indicate if it's a first dose, second dose for those staff, or if it is, sorry, there's some background noise there. So, or if it is which vaccine? Is it the J&J? Is it the Moderna? Or is it the Pfizer? And so you actually have to designate between all of those things. And so it will take someone an effort in order to keep that updated on a weekly basis for you to report. So just keep that in mind as you're moving forward. Okay. And so I'm going to.
I had one more jump in. On the survey side, I wanted to update everybody on a recent trend, and it's regarding immunization. So we have one particular district office that's trending right now with their interpretation of immunizations, and it's regarding consent versus informed consent. So make sure that you are able to speak very knowledgeable on that subject with the surveyors, because remember, the surveyors are new. They're going through training courses rapidly. They're having staffing shortages just like everyone else across the United States. They're just as impacted. The surveyors are just as impacted by staffing shortages as the rest of us are, with the challenges of COVID-19 and so forth. So the biggest trend I'm seeing right now isn't just on the COVID-19 consent versus informed consent. It's also on the pneumonia and the influenza. So one of the district offices currently is interpreting it as being informed consent is needed for immunizations and vaccinations, and it is not. It's right on the CDPH's own website under their immunization page. It's only education, and that education could be in the form of the VIS or the emergency authorization, as Deanne mentioned before. And what you would do to those surveyors is you could direct them to those sources, their own immunization page, to give them education while they're saying that they're going to cite you for this, or you can direct them also to this newest QSO, and also you can reach out if you're a member to CAS, to me anytime, to help you before they exit, to give them the correct information to get them back on the right path.
Excellent. Thanks, Patty. Always great advice. We definitely want to keep our surveyors on the right path. So that way we're good. Okay, so one more time, I'm just going to say, if you have any questions, please go ahead and put them into the questions box. It's on the right side of your screen there, and we'll read those aloud. I do have one right now, and it just asks for recommendations regarding family visitors from foreign countries that might have been vaccinated outside the United States, but not with the approved CDC, let's see here, it's kind of a small screen, apologize, without vaccine. So right now, if the vaccination is approved by the WHO, the World Health Organization, then we can consider individuals to be vaccinated if it is with one of those WHO approved, even if it doesn't have FDA approval here in the United States. If it is outside of either our approval or the WHO's approval, then we would not consider them to be vaccinated. So that might be a challenge, and you can work that into your policies around that. Of course, you know, we know that there are some really bad hotspots outside of the United States, and so we want to make sure that we are checking the CDC for, you know, any of those recommendations around, you know, quarantining or, you know, for individuals that have been into those countries. So just keep an eye on that as well, beyond just their vaccination status, because they may not, it may be that you would follow the CDC guidance regarding visitors who have recently traveled to those countries of concern around COVID. All right. And that was from Justin. Thank you, Justin, for that question. I can see we have another one here. It says, do we know when the after action plan will be due? Ben, thank you. I don't have that answer. So I will push that over to Jason just to be sure. I think that it is not necessarily a specific due date, but I believe that you're going to want to make sure that it meets your criteria for when you have the survey, and, you know, have you completed that and initiated an action plan within the time frame of your 2 exercises every year. So you'll want to probably just have it done within that time frame. But again, I will push over to Jason just to clarify and make sure there isn't a hard due date. All right, so we have another question here. What does offer the vaccine mean? Every corner drugstore is offering the vaccine, so does that count? Or does a facility need to do the jab? Awesome. I love the way you put that. It's true. Every corner now, Barry, is offering the vaccine, which is a great place to be in. But I would say that no, having the vaccine available out in the community does not mean that you have offered the vaccine. You would want to be in charge of that internally. So for those staff that are at your facility, very specifically providing them education around the vaccine, getting that documented, and then documenting that you have specifically offered to them the vaccine. So I would not use those. Oh, sure.
Go ahead. Sorry, Julie. Yeah. Oh, I was just going to jump in. It's just like your influenza or your pneumonia vaccine. You know, your other vaccines. Think of it that way. You know, some people have then you blah, blah, blah. The other one is you have the declination form where they declined it, and they could decline it in the facility for a lot of reasons. One, they've received it elsewhere, or two, because they, you know, they don't want the vaccine for whatever various reasons they have. So you just want to document it on some way that you've offered it, and whether they've accepted or they've declined it, and prove that process. And keep it in line with what you're already doing for your immunization programs already. Keep it in the same systematic way. You know, you've already doing this. We know it well from influenza every year. And I would align it with what your current practices are for that.
Terrific. Thanks, Patty, for jumping in. It is true. We are very well versed with this whole vaccination thing. So we probably shouldn't be thinking of this as any different than that. We want to make sure to have all that documentation. And again, we want to make sure that we also have that education of the family members, and also those people that are in our facility at least once a week. We also need to make sure that we have documentation showing that we are doing that outreach with them as well. That's, you know, a little bit broader than what we normally do with flu, but we are being asked to make sure that we are providing that education to those sources as well.
And our contracted employees, right? Isn't there a caveat?
Yes, absolutely. Yeah. So if we have contracted therapy, housekeeping, dining services, wherever that contract may be, we want to make sure that we have that documentation, that we've made that offer, so that way we have it ready to go for when it's asked. And if your contracted company has already offered and has that documentation, then, you know, you can ask for, a statement, of course, that shows that, or make sure that you're confident that they can produce that documentation upon a survey rapidly, so that you have it accessible. All right, we've got another question here. And of course, this is going to be more along the line of our safety guru, Jason, but I'm going to read it out loud here. So does the Ppe order via the MOOC go through the HMA/NOI, so Notice of Interest, or the PHOS, which is the Public Health Ordering System? So on our slide, let me see if I can back up a little bit, because Jason did pop that right on here for you. It is through that Salesforce sign up. Now, if your county doesn't use that, your MOOC doesn't, I'm not sure if every MOOC does. So I'll push this over to Jason just to follow up, but he is saying that you want to put in that request through this Salesforce sign up. And through the slides, you can just click on that link that Jason's provided, and it should take you right where you need to sign up, which should be through your MOOC. All right. Let's see here. Got another question here. Does family in green zone require a face shield or just a mask? And I think this has been asked a few times on our weekly calls with CDPH. You know, do we still have to do the face shield in the green zones? And their response has been no. Our staff doesn't have to wear the face shield in the green zones anymore. And Patty can jump in if I misheard that. So that would probably also include our family members as well. So when we're in the green zone, the source control is really what they're going to be looking for. But again, have the process of visitation set up so you know that the family, where they're going and where they should be. So if it's a specific room, whether it's their loved one's room or a visiting room, that you know that they can go directly to that location and back, so that they're not wandering through your green zone. But the face shield is not a requirement in that green zone, unless, of course, you expect to be doing some kind of aerosol generating procedure. And then, you know, you want to make sure to provide the appropriate protection for your staff. Patty, anything to add to that?
No, I don't, Deanna. Well done. So
all right.
That's my interpretation as well.
Terrific. All right, so here we go. It takes approximately 3 weeks for CARES to approve a facility to check the vaccination data. And I think that, yep, that's just an FYI. Thank you, KJ, appreciate that. So again, we want to make sure that all of you online here are, if you haven't signed up for that CARES system, that you are doing it. And it's the California Immunization Information Registry, so it's CIIR system. And again, if it takes 3 weeks, then you want to be working on it now, so that way you can start checking people's vaccination status. and have accurate information so that you know when and how, of course, to not only check that status, but then if you're going to be responsible potentially for doing those booster shots, that you'll be able to enter them into that system. So we're encouraging all facilities to go through that process to get registered under CARES.
Yes, and I wanted to jump in on that. And while you're doing that, you know, as for the reporting portion or for the offering portion, you know, if the employee says they've had it and then they sign the declination statement where they decline it, or it's unknown, or the status, and then you would, in the system, I believe right now, NHSN, you would capture them as not vaccinated unless the employee said they were, or so it gets a bit tricky, but the training that NHSN provided does cover and include some of that on that CDC training, and it helps understand the reporting portion of that. Anyway, I just wanted to jump in on that, Deanne.
Excellent. No, it's good. I appreciate you adding and bulking up our responses so that we hit everybody's needs. This is a little bit longer question, so I'm going to have to scroll through this tiny writing and get out to you. But the question is that we've discussed this in the past, but let's have some additional clarification, guidance for rehab for residents in the yellow zone. Patty, I might need your interpretation on this one too. But for new admits in the yellow zone, but again, remember that if someone is fully vaccinated, they don't have to go into the yellow zone unless there's some major outbreak at the hospital. You should be able to admit them right into the green zone. So I'm just going to say that first. So fully vaccinated, they can go into your green zone, obviously, unless they're, you know, actively showing signs and symptoms. So if you have a new admit into a yellow zone who has orders for rehab and might benefit from using specific rehab equipment that is in the physical therapy room, which obviously is outside the yellow zone, can they be escorted to the rehab room while practicing source control to use these equipment, which will then be sanitized after use, then return to the yellow zone. So on this, you know, I would think that, you know, for our residents, you know, we want to provide the best care. And if that, you know, if you can provide, you know, the source control and not expose others, I think that we have some flexibility, but I am being interrupted on my end here. So Patty, do you have something you would like to add?
I don't, and you know, all these questions are going to be sent over also for all of our review. And Jason, if we have anything additional to add, or we want to more clarification, we'll make sure we get that back to the member or put it out on the forum as an overview of the question and what the correct answer is as we look at all these questions.
Thank you, Patty. Sorry about that. You know, working from home sometimes is a challenge, so I was a little distracted. Thank you for jumping in. Yes, we'll get further clarification as well. All right, next question. Are you hearing anything regarding the return to the old LNC surveys? Any new areas of emphasis? And will they expect to see an updated mitigation plan? Thank you. Yes, we do have a little bit of information. As of April 1st, CDPH has made it clear that they have initiated, and we have seen activity out there, the regular certification surveys. So we're happy to hear about people's experiences in that area. Patty, I know you've talked with several providers. Would you like to maybe talk a little bit about areas that they've really emphasized? Of course, I'm sure infection prevention, and then anything on that mitigation plan. I personally think that we ought to keep the mitigation plan updated to our current situation, but we have seen a lot of people who haven't been following their mitigation plans to the T and then have had deficiencies. So if you can't keep it up and keep it current to your experience, then you'll want to, you know, like integrate it into your disaster plans. But it's really important because it's so specific to what we're going through. If you're able to make sure it actually meets what you're currently doing, then having it would be good. And if you have a policy, you know you can be surveyed to it. Patty, any specific emphasis or trends that you're hearing?
Oh, I'm sorry, Deanne. No.
All right. Yeah. So at this point in time, we know that they're out there. They are back in force, and so expect them to be coming through your door. So I would, do your regular, preparation for your survey. I think some of what they've talked about is, with their data systems, they're looking at people who they feel are a little bit more at risk than others and are initiating their surveys with them to wrap out this survey cycle versus, a facility who, let's say, is due first, who's maybe at, 20 months without an official licensing and certification survey. They are not just going in that based on the time frames. They're doing it more along their analytics and who they believe is might be more challenged and might be having more issues than others. So it's kind of like, oh, this is I'm in my window. I think that right now until they get into the next survey cycle is kind of out the window. So just know if you meet some of their triggers that you might be up for a survey before maybe someone who used to be due for survey before you. But I know we're always survey ready, right? So we know that we will be ready for them. All right, so we are getting close to the end of our time. I can't believe it, almost 2 o'clock. So this next question, is the facility charged for the 30-day PPE? Great question. No, this isn't a charged fee for the PPE. It is part of their sustainment supply, and so they are pushing these out to our facilities. Nothing in the AFL says anything about any charges to the facility. So I think that we are okay on that one.
Deanne, I have one other thing to add in that I think that just at the end here, and I want to make sure all facilities keep aware of the fact that they need to track all the time and all their staff work that's involved in this for your CARES Act fund reporting. So that's really important to kind of quantify the time and the effort that it takes for your staff to get these new requirements done, because this is going to be really important in the end.
Terrific, absolutely. We definitely need to do that. It builds up our cost reporting information, and it shows that 10% increase that the facility's been receiving is being used, and it's being used for purposes focused on the COVID response. I'm going to circle back real quick to Barry. He was like, he doesn't have any way to offer a vaccine at his facility. And if that's the case for any of you out there that you don't have a pharmacy partner that has access to it, if you document your due diligence, right, and trying to figure out how to provide the vaccination for your staff and residents, and it's just not something, keep that documentation, and then reach out to your local public health and find out how those resources can be made available to vaccinate new staff members and new residents. And then you can just keep documentation that when you have a new staff member, you are educating them, and then you're connecting them, again, with documentation, to the resources that your local public health is stating for you to use. So if anyone is also in that situation, that would be really important to do. Okay, and I think we have this last one again. Thank you for all the great questions, everyone. Let's see here. Oh, thank you. Someone gave me an information that would be for Jason. So the assistance was within Salesforce, it is the PHOS icon to place your order. So thank you so much, Heather. Appreciate that. So it is the PHOS icon. Okay. All right, I think that wraps up our time. Again, I don't think we missed maybe but 1 or 2 questions, but we will definitely pull those and get back to everybody and get that available to you. Really appreciate you bearing with Patty and I as we pretended to be Jason on this wonderful Friday. We are wrapping up. Thanks, Patty, again, for all that great interjection. Appreciate it. And Jason will be back next week, so you guys can show up in abundant numbers and make them feel welcome back. And hopefully, again, we will have those AFLs that we've been waiting a few weeks for, so that we can go over those and share those with you. Again, thank you so much for being here and all the hard work you're doing to keep our residents safe out there, and we will see you next week. Thank you, everyone.